This month on the Taboo Topics podcast.
If someone is unhappy with an outcome from a surgery, whether it's cosmetic or reconstructive, definitely is within their right to seek expert advice from a different physician, a different surgeon. I think that taking control of that and saying, I want a second opinion is the first step to all of that.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast at orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, and welcome to Taboo Topics, where we discuss embarrassing personal health questions and try to take the stigma out of those discussions. I'm your host, Mary Frances Emmons. Today, we're talking about what to do if you think you've had a botched surgery. My guest is Dr. Kenneth Lee, a plastic surgeon at the Orlando Health Aesthetic and Reconstructive Surgery Institute. Welcome, Dr. Lee.
Thank you for allowing me to be here.
First, can you tell us a little bit about your work at Orlando Health?
I've been at Orlando Health now for 17 years, actually. So I am a reconstructive microsurgeon. I deal with complex cancer-related defects, complex traumatic-related defects, and pretty much the entire breadth of plastic surgery, including aesthetics.
Wow. So plastic surgery is usually a very personalized thing. So how is a botched procedure different from a patient who maybe just changed their mind about what they wanted?
The term botched, I think, is so very interesting. It stems probably back to the TV show Botched, which really popularized the term. And now many patients use it when they're dissatisfied with a plastic surgery procedure. And so it's become synonymous with someone that is unhappy with the final outcome. The hard part about that word is it is very subjective. And I think that when a patient doesn't feel like their expectations are met, then they can feel like they were quote unquote botched. So it could not be a physical disfigurement per se, but definitely a very personal one because they feel like they did not achieve the outcome that they really wanted. And so they're very unhappy.
Just so people have a greater understanding of what we're talking about, what kinds of things are we talking about when we refer to a botched procedure?
There are two arms of plastic surgery when you think of plastic surgery in general. There is the aesthetic cosmetic side, which is the things that many people in the public think of when they think of plastic surgery. They think of aesthetic surgery or cosmetic surgery, which is really a procedure to improve the aesthetics of the face or improve the physical outcome of what they're trying to achieve. So that is cosmetic surgery. Then there's reconstructive surgery, which is usually a repair of something that happened, whether it's trauma related or cancer related. And so the term botched can really be used for either one. I think traditionally when someone says, oh, I feel like I got botched, it really intends for to be the cosmetic side or the aesthetic side. But we've been hearing the word more frequently used in the reconstructive side as well.
So as a patient, what's the first thing you should do if you think that you have had a botched procedure?
Great question, Mary Frances. I think the key to all of that is that as a patient, you want to be in control of your care. And so one of the things I try to impart on many patients that come see us for secondary consultations, that it is their right to seek secondary consultation. And so if someone is unhappy with an outcome from a surgery, whether it's cosmetic or reconstructive, definitely is within their right to seek expert advice from a different physician, a different surgeon. I think that taking control of that and saying, I want a second opinion is the first step to all of that.
So we're talking primarily about surgery right now, but can a botched injection or a botched filler also require a surgical correction?
Most of the time, minimally invasive methods, which is known as injections like Botox or fillers, even if the outcome is not ideal, usually doesn't require surgery to fix. Many of the things that we are talking about when we're talking about injectables are temporary, and over a period of time, that actually gets better on its own. Now, there are injections that have a permanent impact or a semi-permanent impact, which means that it can be there for a long period of time. In those type of injections, there are medications that you can inject to dissolve what was placed there initially that you may feel like you're unhappy with. So definitely non-surgical aesthetic treatments such as fillers or Botox can make a patient feel like that they're botched as well. But once again, many of those minimally invasive methods can get better with time.
More on this after the break.
This episode is brought to you by the healthcare leaders at Orlando Health, where we deliver the future of medicine today. Orlando Health. Choose well.
So for the surgical procedures, what's the most difficult thing for a surgeon about trying to correct somebody else's work?
So I think that the most difficult thing is trying to meet the patient expectation, right? So there are two aspects to it. One is the psychological aspect of reoperating on a patient that's unhappy with the surgical outcome. And the second one is just trying to understand what was performed in the last surgery. And so that is more of a technical thing. So for example, if we talk about you feel like you got botched breast surgery, you really want to have a good understanding when you're taking care of someone secondarily, like how was that surgery performed? In what method or technique did a surgeon use? And that'll allow you to figure out what is the safest way to undergo a secondary revision. In many ways, the latter thing that we talked about, which is really the technical aspect of it, is actually easier than meeting the psychological aspects of expectations with a patient. So whenever I'm seeing a secondary consultation and someone that feels like that they're unhappy or botched, I feel like the most important thing is the consultation itself. That you get a really clear understanding. You get right to the understanding of what exactly is the issue. Many patients have a hard time relaying what is it that they're unhappy about, but you have to drill down to those issues. You have to figure out, is it a size issue? Is it an appearance issue? Is it their expectation was something different? Really, really thoroughly understanding what a patient really wanted. I feel like many times in these secondary consultations, the meeting the expectation is the hardest part.
Is there ever a point with plastic surgery that even a skilled physician just can't fix it?
I think that it depends on what the poor outcome is, right? So say, for example, someone had rhinoplasty, which is the standard word for a nose job. And after surgery, they don't breathe as well, right? So that's a functional issue. I think there are many things that we can do when there's a functional issue, like partial collapse of one of the parts of the nose, which allows a patient not to breathe as well. Those are things that are very black and white that we can help with. But many times, say, for example, in a rhinoplasty, that someone is unhappy with the shape of their nose, right? And the shape of the nose is, I can think of 25 different things right now that affects the shape of the nose. And so all of those things we have to discuss in detail with thorough analysis, with expectations, drawings, pictures, just to get on the same page as the patient if you're going to tackle a secondary revisional procedure. The expectation is the most important part. What can be done and what potentially could happen, and could it be possible that they're still dissatisfied? Or is it that we cannot make a patient happy, which is also possible? I think as a surgeon, that's a very difficult thing because we surely are confident people. To become a surgeon and go through the things that you do, you have to have a certain confidence about you. But the hard part is admitting that you cannot achieve that desired effect, right? And so in secondary consultations, it's really important for a surgeon to figure out, can we help that patient? Can we help them through surgery, which results in psychological healing, which results in feeling less botched? Meeting expectations is the most important thing.
So it sounds like conversation with your surgeon is among the most important parts of this whole procedure. What other things can a patient do to avoid getting into this situation of feeling like they have had a botched procedure?
Many times when you see secondary consultations, patients will tell you, well, I just didn't feel right when I had the first consultation, but I proceeded because on the advice of another patient. And you feel like it's rushed, or you feel like that you didn't get your voice across, or you didn't get enough time with the surgeon, or you didn't get a secondary visit when you really wanted one. All those things are really important. It's important to trust your gut. You have to trust the person implicitly and explicitly, because You don't have any control when you're under anesthesia. You have to trust a surgeon to that degree. And the only way to get there, to build that trust, is spend a lot of time with the patient and really try to understand. Even simple procedures like breast enlargement or augmentation, right? Putting an implant in. I think that it's not as simple as making a breast larger. There are 10 different ways a breast can look once it's been augmented for volume to make a larger breast. And so if we don't spend enough time with those things, you're likely going to disappoint a lot of patients. And I think it's also important to make clear to patients that we are the furthest thing from God, right? We have surgical techniques. We care about patients. We want to meet their expectations, but there are some things that we just cannot do. It's difficult because you also have to maintain a realistic view on what can happen and what should happen, and then what can we not do, right? What can we not achieve? And so those conversations are extraordinarily important.
Well, I think this will go a long way to empowering people to make sure they are being heard and are getting that time with their surgeon. Is there anything else that you would want listeners to know about not getting into this situation?
Yeah, I think there are two things. I think what I always wish I could tell patients, one is that many times patients are unhappy the first week after surgery. And I think that's a really hard thing. I'll see a secondary consultation for revision on a patient that had surgery last week with initial bandages. And so I think that the key to understand is many times you have to let things heal a bit, right? And yes, you could be unhappy with what you see right away after surgery, but sometimes it's important to let things try to evolve and try to, quote unquote, calm down from the surgery itself. There definitively is swelling. There is trauma to the tissues when we operate, and that takes time to get better. And I think many times patients want to jump the gun and have another operation or a revision immediately, when it is really, really fair to let things settle to where they belong. You have to let things settle down. The second thing is, I would encourage patients, unless you just had this terrible experience with a surgeon, is really give the surgeon a chance. It's important to give that surgeon a chance to explain what is going on and what they see. I mean, I think that's very fair for any surgeon-patient relationship.
Well, you have certainly given listeners a lot to think about. And thank you so much for being here today, Dr. Lee. Listeners, you can learn more about Dr. Lee and his work at orlandohealth.com. And we hope you'll join us again on Taboo Topics, Dr. Lee.
Thank you so much. Thanks for having me.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.